Good morning, everybody. John Sidoti here, the local state member for Drummoyne. I just want to commence by saying that it's an absolute pleasure to be here and watching the growth of the hospital, particularly over the last few years. We've been here on a number of occasions to mark some significant milestones, and can I say none more significant than today. And I want to take this opportunity to acknowledge Dr. Teresa Anderson, all the staff and the management here at Concord Hospital, because the work they've done has just been incredible. And also acknowledge the building and construction company for the work they've done. This is just moving at the rate of knots, and it's great to see so much work being undertaken here. And also acknowledge the Minister for Health, the Honourable Brad Hazzard, who's here, who's been instrumental in this project moving forward. Brad, you can recall probably a year ago, possibly before 2015, when an announcement was made for $150 million spent for the hospital, and we knew that wasn't enough. And the Minister at the time came, he did the inspection of the hospital, and within a short period of time announced a $341 million bill here at Concord Hospital. So I want to acknowledge that, because health is paramount to my electorate. And it's good to see so many staff and construction jobs. This is what government's all about now. Making sure there's jobs and more jobs, and we're seeing that, and we're seeing the benefits of this construction and the multiplier effect to our community. So on my behalf as a local member, I'm very, very proud and honoured to be here today. I want to just say the staff here do a wonderful job. It's great to see the infrastructure part of the hospital, but it wouldn't be the same without the heart and soul of the building, and that's the staff here. And travelling around the state and visiting so many hospitals, I can tell you that in some form or another, staff all over hospitals around New South Wales acknowledge the contribution and the hard work over a long period of time that this hospital actually does. And I can tell you it's all positive feedback. So to every staff member here at Concord Hospital, congratulations for what you do for our community. It wouldn't be the same without you. So thanks once again, and I'd just like to now hand you over to the Minister for Health, Brad Hazzard.
Thanks very much, John, and good morning, everybody. I want to start off by just acknowledging the traditional owners of this land upon which this incredible hospital is built, the Wongal people of the Eora Nation, and thank them for their custodianship of land for about 60,000 years. 1941 was when the first military hospital was built on this site. I'm more than passingly aware of that. My dad was one of the people who were in here post the Second World War and during his life. And there have been many, many veterans who passed through the doors of this hospital. There have been many others who were not veterans. And what we have committed to here is to make sure that the community of the Inner West, but the broader veterans community also have an opportunity for world-class healthcare in world-class facilities. Our doctors, our nurses, our allied health staff, they're world-class. But to give them the tools here in this incredible clinical services building, this 7-storey clinical services building, is just that extra step. John Sidoti said it was about 2017. Well, actually it was a Sunday morning in 2017 here, and I was here with the Chief Executive of the City Local Health District, Teresa Anderson, here with health infrastructure officials, and of course today we've got Rebecca Walk and also Lisa Rathbone and the rest of the team from Health Infrastructure. But we stood here, and I remember it was in one of the darker courtyards area, not far from here, and some of the doctors who had been saying they needed to have new facilities to empower them to give their very best were actually in tears that day. It was a very moving day. To come back now in a relatively short period of time and to see the work that Robert Spitzerotti have actually achieved, the entire design team have achieved, I have to say it's close to a miracle to see it's already being fitted out, not just having got to the top, but it's already being fitted out. I want to thank all of the builders, all of the guys, the apprentices. I just met a few of them downstairs, standing up the back there. Guys, thank you so much for the work that you've done and the learning that obviously Robert Spitzerotti has managed to open the door to you to have. It's so important that as we do these projects, as a state government that we also support our apprentices, no matter what area of building. Can I also acknowledge that Robert Spitzerotti has been very supportive of the Indigenous community, the Aboriginal community, and a number of Aboriginal people have been on site working as well, and also learning new skills and using skills that they've developed. On behalf of the government, I just want to say thank you to the entire team, all of the builders, all the designers, all of the people who brought this together, and particularly those who've been at the coalface doing the actual building work. Teresa, this is an amazing new facility. As I said, 7 stories. It has the new facilities, of course, the National Centre for Veterans Care, and I was actually here with a very well-known former veteran who'd served in the Middle East, and he explained to us that being able to have all of the facilities in one place. You know, when you come back, for example, from our service people who've been in the Middle East, he was explaining that they can come back very traumatised and physically wounded, physically injured, and to not have to go hunting in many different locations to get the services, he said would make a huge difference. That is what underpins what we have here in this new facility as well. The capacity to let people who have served us in overseas theatres of war, but elsewhere as well, peacekeepers and so on, those veterans to be able to come and have all the services. I mean, I think many of us have been from time to time in a position where perhaps psychologically we're not doing that well, and you know it is difficult to go out and find the services you need, and often it's multiple services, and certainly for our veterans, this will now provide the opportunity for them to be able to have the services right here, but also to be able to know that there's a supportive community team here, allied health and doctors and nurses, psychologists, all sorts of people who'll be able to give them a path forward and to give them the support that's necessary. So again, thank you. Topping out ceremony is pretty important. When the tree arrives, it's a symbol that's come from many years ago in Europe, in Northern Europe actually, and what it tells us is renewal. We are here. We have arrived. Today, the new clinical services building, the $341 million building, has arrived, and it's compliments of every one of the staff who've worked on this site. So on behalf of the Berejiklian and Barillara government, thank you so much for all the work you do. I can't wait to get back here in about a year's time when it's all finished and being commissioned. That will be another tremendous day, because that will herald the welcoming and opening of the doors to patients. So thank you very much. I'm going to ask the Chief Executive of Sydney Local Health District to actually come and to say a few words. Just, I think Teresa knows that my dad was also the hospital engineer for this hospital and for a group of others that operated in the Sydney Local Health District some years ago. So Teresa, I'm sure my dad would be actually giving you a big tick as well for all the work you've done here. Teresa Anderson.
Thank you. Thanks so much. Thank you so much, Minister. This is a wonderful day for all of us. Thank you, Rebecca. A wonderful day for all of us. It's hard to believe that really so little time has passed since we made that announcement, and to see the incredible work that's occurred here. I'm really appreciative on behalf of all of the patients and staff in the community of Concord Hospital for the support that the New South Wales Government has given to the redevelopment of Concord Hospital. And this is a real partnership, a partnership with our local community, our patients and their families, our staff, very importantly with health infrastructure, and Robert's Petrolian. It is incredible the amount of work that's occurred here, the level of consultation with our patients and our staff has been remarkable, and what you will see in a year's time is a really remarkable building on one of the most beautiful sites in this state. The Minister's beautifully outlined what this building is going to contain. A fabulous integrated rehabilitation service, the comprehensive cancer centre, and very importantly the National Centre for Veterans Healthcare. All of these services are integrated with the rest of the hospital. This redevelopment gives us world-class facilities to go with our world-class clinical care, and we're really appreciative to everyone that's been involved. It has been a mega project and has been absolutely supported by the Minister, the Honourable Brad Hazzard, and the Minister John Sidoti, our local member. So thank you all very much for coming today to celebrate with us the beautiful tree, the beautiful topping out on one of the most beautiful sites in the state. So thank you all very much.
So with that, because our tree has already arrived, compliments of the incredible people that work these cranes, I'd just like to perhaps ask you all to join me in clapping and welcoming our new tree to the top of this building and saying, well done to everybody, well done, thank you. Even the tree looks happy, it's good, it's good. Now, for those of you, we'll do some photos in a second. I'm not sure how enthusiastic or how many journalists there are here today, but they normally like to ask some questions completely unrelated to anything we do. But I'll just let them do that if they want to do that. Otherwise, I'm just letting the journos know that we do have another press conference at 11 o'clock over at Homebush. So perhaps, unless it's really pressing, we could leave those questions until I'll be over there with the Premier in about a half hour. So, but I'm happy to answer any questions if you're really energetically enthused. If not, we'll leave it until 11 o'clock. Great, thank you. So, one question, yes.
With some recent,
a journalist in disguise, yes. Go on, Jack.
With some recent transmissions in NSW that we don't know the source of yet, could people who have planned holidays in out of state be worried?
Look, we'll be talking about that at 11 o'clock. I'll just say this, that it's unrealistic to ever have expected that this virus, which is a 1 in 100 year pandemic, would simply disappear. That's not going to happen. It hasn't happened anywhere in the world. But New South Wales, through our incredible work from our tracing team, our health team generally, and supported by others, including the police, have created a system that is keeping us as safe as anywhere in the world. So it's fair to say that there'll be an announcement a bit later on about a number of cases that have arisen, but fairly confident that our tracing team are doing all the necessary work, as they have on each occasion previously. All right, well, thank you very much. How about we try and get a photograph of everybody, but socially distanced, or I'll be in deep trouble. Over this side, guys. Where's the guys from the HI? Can you do it? Line it up and get everybody lined up. Come on, everybody. If you build it, if you've had lunch here, if you've had a coffee, come on over. At least have a photograph of this special day. The taller you are at the back, the shorter you are at the front. Lisa, you're at the front. Come on, guys, jump in. Come on, it's a special day, John. You're going to kneel down already. There you go. 1, 2, 3, down, go. Okay, here you go. Jump in, guys, as tight as you can without being too silly with COVID. Okay.
Maybe if we get you with a smaller group.
Get a what?
Anderson and John.
How about we keep everybody in the back, we get in the front. Is that all right? And everybody's still in it. See, I do some real work. See that? Actually, I don't want to be in front. You jump in front. There you go. And you. There you go. Yeah. You're all in it? There you are. All right. Let's get the camera here.